For the last 2 days, Dr. Anthony Fauci has been testifying behind closed doors to a committee in the United States House dedicated to getting to the bottom of just what happened in our great country and to our great country. Here with more details on what was actually revealed behind closed doors is Congressman Brad Wenstrup. He's from Ohio's 2nd Congressional District, and he is the chairman of the Select Subcommittee on the coronavirus pandemic. Congressman, good to have you with us, sir. Thank you very much.
Vince, it's my pleasure to be with you today.
Boy, I want to, first of all, I just want to give you a round of applause for talking to Anthony Fauci for 14 hours straight. That feels like it'd be painful, honestly. But what did you learn over 2 days?
Well, we really learned a lot. I mean, it was a 14-hour deal, and we split time with the minority, so Democrats have just as much time to ask him questions. Well, I think we did a lot of research, and we were very prepared to ask him a lot of questions. You know, one of the things that we did in an effort to get ready for Dr. Fauci is to talk to all those that had worked around him, or at least as many as we possibly could, so that we would have data of things that were actually said. And we subpoenaed conversations between some of the scientists that wrote Proximal Origins that Dr. Fauci came on the White House lawn and talked about as definitively it seemed to be coming from nature. That's basically what it came across. You know, now he says he's open to the possibility of it coming out of a lab. But I will say that, you know, he didn't recall things over 100 times. And he didn't recall conversations about the origins of COVID or the Wuhan Institute of Virology with President Trump or President Biden. Didn't recall having any conversations with them.
Wasn't
I don't know how the rest of America could be having these conversations, but he wasn't with the president.
Of course, he's lying, from my perspective.
Yeah.
So, you know, wasn't he at the center of trying to suffocate the consideration of the lab as being the source of COVID? He was working behind the scenes to get people to bury that as an issue. So now he says he doesn't remember that?
Well, it certainly seems like he had connections with the people that wrote the paper that it came from Nature. We have the conversations he was having with them. He put them together. He even, during those conversations, said, we know they're doing this type of work in Wuhan. All the people that were on the article had said that this thing looks engineered. There's no way we can rule it out. And even the very day that he released on the White House lawn saying, these scientists said it came from Nature, and I'll share this article with you, that same day, one of the authors in his internal documents said, we still can't rule out engineering. And that same doctor is the one who said, I'm focused on disproving the lab leak theory, in spite of saying that they thought it came from the lab. So we have a lot of evidence besides just our conversations with him.
Yes.
But it gave us a chance to ask him about it. And if he said something contradictory to what we have in evidence, I think that's going to be very foreboding in the future. But as much as anything, you know, we wanted to figure out how our government structure works or doesn't work and have lessons learned. And there were a lot of lessons, you know, because you have the nation being told, be 6 feet apart. And what he said was that guidance just sort of happened. You know, a lot of times he'll talk about the golden rule and you got to have double-blind studies and things like that. And yet he said that just sort of happened. He also admitted that the vaccine mandates could increase vaccine hesitancy. And I said, you know, we had a very hearing on America doesn't do well with because I told you so. Americans want to be educated, not indoctrinated, and they want to talk to their doctor. And the mandates themselves came from a politician and said, you must go get this shot. And he never said anything about go talk to your doctor, see if it's best for you, discuss your health with your doctor. What can this do for you? Just like any other medication. So we were doing things in terribly wrong ways and trying to manage the American people. And so the trust in our government agencies and health have been greatly diminished. And so I think we made a lot of headway.
Yes.
And I think we've got him saying he's changing his mind on a lot of things. So that can be a positive for us going forward, especially to those who follow him religiously.
Yes.
And so we have next steps. We got a lot of work to do. to devise a system that's actually going to work on behalf of the American people and not for political and personal purposes.
There's so many things about Anthony Fauci that drive me crazy. One of the things is that he admitted to the New York Times at one point that he was lying to the public about herd immunity thresholds. He said he was watching public polling, and then he would change the numbers in his conversations based on how comfortable the public was with the numbers he was sharing. Did he account for that at all in your behind closed doors testimony?
We didn't get into that, but basically you're talking about scientific versus political.
Yes.
Because if you're polling what people think, that's not how science works. Science works on facts. Now, you can have hypothesis, and you can, I'm a doctor, you can have a hypothesis, but one of the things I said to him, too, about origins is he said, well, I talked to these evolutionary virologists, and this is what they said. And so I went with that, but I'm open. Now he says he's open to other ideas. I said, but you haven't talked to anybody with any other ideas. You haven't explored that. You haven't said that. You never did say that. And then I asked him and I shared some research with him and asked him if he's ever read these pieces, these published peer-reviewed articles. And he said, no. I said, well, it might be good because they talk a lot about the science behind creating a infectious virus in the lab. And he also, it was interesting because, he had the interactions with Rand Paul that so many people know about, where he said NIH does not fund gain-of-function research. And what he said about that was basically, well, he has a different definition of gain-of-function research.
That's crazy.
Well, when did he come up with that new definition? It came up later.
But also,
it's that afterwards.
And also, that semantic game is a way of avoiding the underlying issue. Was the United States funding research that made viruses more dangerous in China? Yes or no?
Yes.
Yeah. And yes, Fauci doesn't even want to admit it, does he?
Well, we've had some people that he knows that have answered that question with a yes, and that will come forward at some point.
Okay. So we have more testimony yet to be made public. Will we see a transcript of Anthony Fauci's testimony before your committee?
Yes, we will release it. It has to go through, and his team has to approve it as well as the minority and the majority, and we review it to make sure that it's accurate and everything before it goes out. So I look forward to putting it out. I will tell you, I think we were very professional on our end, and I think that Dr. Fauci felt so too. We let him answer the questions the way he wanted to answer. It may contradict some other facts that we have, but we let him do it. And part of the time, I had good scientific debate with him as a physician, talking about treatment options and why didn't we look more at natural immunity? Why didn't we use the idea of convalescent plasma, which was being used early, where if somebody had COVID and recovered, they could donate their plasma. It could go to someone else, and a lot of people were helped by that. We just kind of dropped that. It just became vaccine almost only. Very little talk about the monoclonal antibodies. There was talk about that in the antivirals, but there's other opportunities out there too. When you understand the science of who gets infected,
yes,
there's just more things that we can pursue in the future if we see a virus like this again.
Also, why did the CDC and the NIH, why did they sit on so much data and not release it to the public? Right? I mean, there was a lot of information that was of value that was being held back, including the incidence of myocarditis among young men, about the efficacy of these jabs among younger people. It wasn't that high, that masks weren't really working, that filtration systems on airplanes were phenomenal. There was no justification for masking people on airplanes. That was always crazy, and it was well known early. Why was the federal government incapable of admitting any of that?
And that's the thing. If you look, he started off by saying you don't need a mask, and then he said you do need a mask. Well, what people expect to hear from public health officials is if you're changing your mind, that's fine, because as new data or new science comes in, change your mind, but explain why you're changing your mind. And I really pointed out that the messaging was bad. And so for example, we talked about how the grant process works for this type of research that we fund. Oh, well, it goes to a board. They're kind of an agnostic board, if you will, and I'm paraphrasing here, but they do that. Once they approve it, I just sign it. So he actually said that he doesn't really read it. And we talked about oversight. So EcoHealth Alliance, for example, wasn't doing their required reporting on their research to NIH. And there's no red flag that goes up at NIH apparently
Yes.
to say you haven't done your reporting. And so when we asked him about that, doesn't that concern you? He goes, well, that's over in compliance. That's not really my lane. And if I can sum things up, what he was framing his role was really all about understanding the virus and creating a vaccine. Well, that may be true, but America felt like you were the face of all science associated with this. And as a result, it created quite a divide within our country.
Well, so did any conversation about China come up? I remember Anthony Fauci making a lot of excuses for the Chinese government, especially in the early days of the pandemic, saying that they were being great partners, even in the midst of them deleting information and withholding information about how infectious this virus was right from the get-go.
Yeah, and then he just tried to back off and say, well, I don't know what they're doing in their lab. How can I know what they're doing in all their labs? Well, just say that. Say that you don't, but that should be a concern if we're funding any type of research within their lab. That should be a concern for all of us. And you never came out and said much about it. And we were learning what was going on in those labs. And, I sit on Intelligence Committee, and I started, I've looked at bioweapons before COVID ever hit.
Right.
And when this hit, I'm certainly going along that line. And what is going on in China? What is going on in their labs? What do their bioweapons what does their bioweapons research look like with their military and everything else? And guess where it's conducted? In Wuhan. So you got to put these pieces of the puzzle together pretty simply. And when they start destroying data and things like that, that should be a huge red flag. I think right now we have an administration that does not want to hold China accountable in any way. I mean, I don't think when the president just met with President Xi in San Francisco, I never heard anything where they even talked about the pandemic. Not one bit. How can you not be having these conversations? That should be a huge part of that conversation.
It's insane to me. One last one for you, Congressman Brad Wenstrup, again, chairman of the subcommittee on the coronavirus pandemic. They just sat down with Anthony Fauci for 2 days. I see some reports that Fauci told your committee that he's, quote, not convinced that kids actually suffered learning loss during the pandemic because of the government-imposed closures. Did he really say that? He thinks that the verdict is still out of whether it was bad for kids?
That's pretty much what he said, and we countered that. And I can just give you one example. I have a 6-year-old, and so during that time, she's in pre-K, going to school with a mask every day. Well, when it was all said and done, she had to go to speech therapy. Now, I don't know if that would have happened anyway, but when she doesn't see people forming words for 2 years, except at home, that's a little bit of a challenge for a kid, I think. She's fine now, but the learning loss is tremendous. And I said early on, with all of this, even at a higher level, you can't ask a 6th grade teacher to teach a 4th grade class. How are we going to catch them up? That's another thing. So how can he say there was no learning loss because we really didn't do anything? So he says the jury's out.
Yeah.
But then again, he'll defer to, well, that's not really my lane. That's over there in education, and I'm the scientist about the virus and the vaccine.
And of course,
and I will say this too. We in a 2020 email that our subcommittee released early this year, it proved that Dr. Fauci was aware of dangerous gain-of-function research in Wuhan because he talked about it. He was asked about the dangers of gain-of-function research in 2012 in an interview in Weekend Australia, where he said, "Well, I think the benefits outweigh the risk." I brought that up to him. You talked about this. So you admitted there's a risk, but you felt the benefits were greater. Well, you're entitled to that opinion. But I'm wondering if you really have that, deep down, have that same opinion today as you did in 2012.
Did he answer?
No, I mean, I'm saying that now.
Oh, yes.
I wonder, but I said you said these things, so clearly you're aware of the risk.
Yes,
and should have been addressing that.
And it's by your knowledge as a
director,
as a doctor, and as a congressman, is there any evidence that it's ever produced a positive benefit? I don't think there is.
I understand the premise, and so if you can somehow safely create a virus that has potential to be a human pathogen, and in the lab create a vaccine or have a system to quickly create a vaccine or a treatment for that matter,
right?
Then you could have potential benefits long term. And I think that's the thinking of those early on. But there were also those at the same time in the scientific community saying,
yes,
why would we do this? Why, let's just respond to what comes our way. Don't necessarily create something that could potentially create a pandemic. And by the way, there was an article written by Dr. I think it was in 2012, or there was a process of making H5N1 even more infectious and putting out the process, and Dr. Fauci wanted that banned. And I did say, I'm curious as to why you didn't want that with COVID. Well, he didn't. He's claiming he didn't know much about what was going on in China.
He's totally ignorant all of a sudden. Amazing. Thank you very much for asking the questions. Congressman Brad Wenstrup in the Congress, of course, in the subcommittee on the coronavirus pandemic. Thank you, sir.